Today, WHO is publishing updated guidance on the use of masks for control of COVID-19. Here is what's new. In areas with widespread transmission, WHO advises medical masks for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19. That means, for example, that when a doctor is doing a ward round on the cardiology or palliative care units where there are no confirmed COVID-19 patients, they should still wear a medical mask. Second, in areas with community transmission, we advise that people aged 60 years or over, or those with underlying conditions, should wear a medical mask in situations where physical distancing is not possible. Third, WHO has also updated its guidance on the use of masks by the general public in areas with community transmission. In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments. Our updated guidance contains new information on the composition of fabric masks based on academic research requested by WHO. Based on this new research, WHO advises that fabric masks should consist of at least 3 layers of different material. Masks are not a replacement for physical distancing, hand hygiene, and other public health measures. Masks are only of benefit as part of a comprehensive approach in the fight against COVID-19. WHO will continue to provide the world with advice based on the most up-to-date evidence as part of our commitment to serving the world with science, solutions, and solidarity.